Hi, I'm Dr. Lexi Lane with Summit Vitality, and today we've got Sara with Spectracell Laboratories, and we're going to talk about the Micronutrient Panel. And first of all, one of the things that, well, there's a couple of things really. A patient will come in and they're taking a slew of vitamins and supplements, and we might want to know if those vitamins or supplements are a good fit for them from an absorption or quality assurance point of view. Another thing that people might ask is, what should I be taking? And then the third thing is that, well, I eat a whole foods diet. I am a really healthy individual. I take this multivitamin, maybe some greens powders. But the question is are you digesting those nutrients properly, absorbing them properly? And if not, we can actually test for that. So Sara's going to talk to us a little bit about the Micronutrient Panel and maybe why we would choose this particular test over something else.
Yeah, thank you so much for having me. So just to tell y'all a little bit about Spectracell Laboratories, it's located in Houston, Texas, and we've been in business over 25 years. Our flagship test is definitely a micronutrient test. It's a blood test. And some of the important distinctions between how this test differs from perhaps a serum blood draw that you've had in the past is that unlike serum, that can be just a 24-hour snapshot of your micronutrient status.
Can I pause you for a second?
Absolutely.
What do you mean by serum? What is that?
So serum is just the interstate, right? This is the grocery store from where your cells go shopping for nutrients. What our laboratory does is we're working with your live white blood cells, and this is a functional test. Since we're working with your live cells, and we take it a step further. We look inside of the cell to see if you're functionally using those nutrients.
Okay.
And so that's one of the greatest distinctions between our test and maybe another micronutrient test that you've had in the past.
Sure. Okay. And how many micronutrients are we looking at here, and what exactly is this test? Well, can you just tell us what it's looking at specifically?
Sure. So you mentioned for individuals that come in that are already taking a lot of supplements, our bodies are so complex and sometimes there's nuances and more is not always better. If you are taking too much vitamin E, your selenium could deplete, or if you're zinc and copper, folate and B12. And Spectracell's micronutrient test incorporates 33 different nutrition markers. So it's more comprehensive than just isolating vitamin D or B12. Not that those aren't important, but it's just one of the many markers that we're looking at.
Yeah. Mm-hmm. And what will happen is I'll show a patient on the requisition form when we're going to be actually ordering for the test, and you'll see categories for all your B vitamins. There's going to be quite a few minerals there, especially for bone health, and then a whole antioxidant panel is going to be there. And one other thing that I really like about it too is that you guys are also testing for like a fructose sensitivity, which is really cool. And that becomes important in your diabetics or people with metabolic syndrome where they might actually have a fructose issue that's contributing to the diabetes.
Yes, there's some, we can look at if you're becoming more insulin resistant prior to actually getting a diagnosis of diabetes. About so many people, we feel good or we want to stay healthy as long as possible. We feel good, we want to feel great for as long as possible.
Sure. And can you dive a little bit deeper into what you mean by serum versus intracellular? Like what, I'm not quite sure, maybe our viewers might not know what that really means.
Right, so serum, when you have a blood draw, there's a serum separator tube, and they'll actually separate your serum from the rest of your blood and those components. They centrifuge it down, and then the laboratory will look in the serum to see, are those micronutrients present? But just because they're present there doesn't mean you're functionally using them. So I'll use, I'm happy to share my own experience.
Okay, yeah.
My serum B12 is generally normal or even on the higher end. So because I'm consistently test normal in my serum, you would think that I would also be normal inside of the cell, but that's not the case.
Mm-hmm.
Myself and actually about there's literature that suggests up to 30% of people have an MTHFR mutation, meaning that they have a genetic mutation or allele that prevents them from absorbing. So in my mind, all these healthy, my healthy diet, and that should be sufficient. But sometimes it's not always you are what you eat, it's you are what you absorb.
Oh, that's a really, really great comment. So you are what you eat. No, well, you are what you eat, but it's also about what you absorb as well. And it's really interesting you make that point, because a lot of times when we have a patient who's got a lot of different micronutrient deficiencies, we really do take a much deeper dive into how they're digesting and breaking down their food, which then here we are, micronutrient deficiencies, but leading into gut health.
And also too, some micronutrients, like I said, there's nuances, there's complexities with it. So if someone has a deficiency in vitamin A, which might be a little bit less common, the recommendation is not always go take vitamin A. It could be, hey, what's your zinc status? You need adequate and sufficient zinc to properly absorb vitamin A. So again, there's some nuances, and that's why it's so important to not only test, but then work with a provider that can help guide you in the right direction.
Great. Well, hey, if you're interested in the Micronutrient Panel or diving a little bit deeper into your health at Summit Vitality, your body is definitely talking. We're listening, and we're also testing to really, get to the bottom of what's going on. So hopefully this was useful for you. And if you want to know a little bit more about genetic testing and what Spectracell can do to offer that, maybe it's the MTHFR. There's a few other markers that we might want to look into. Stay tuned for that. Thank you.